Hello, I'm Dr. Michael Dansinger, and your arteries are on fire. At least you better hope they're not. The bad news is that most people with cardiovascular disease or peripheral arterial disease have ongoing, daily progressive damage to their arteries. We call this arteries on fire. Unfortunately, you can't feel the fire burning. But if you could feel the burn, it would definitely grab your attention. The good news is you can put out the fire by understanding and eliminating all the different causes of ongoing arterial damage and allow your arteries to heal. During this presentation, I'm going to highlight or blame 10 potential causes of artery damage. Almost nobody has all 10 going on, but almost nobody has 0 either. Most of us have some or most of these issues fueling ongoing damage in our arteries right now as we speak or on a daily basis, and each can be minimized or even eliminated. These reversible causes all cause artery inflammation. Now let's talk about what's putting the flame in inflammation. I'm talking about tobacco and toxins, junk food, high blood pressure, dyslipidemia or cholesterol issues, high blood sugar, obesity, underactivity, emotional stress, gut microbes, and genetics. I'm going to spend the rest of this presentation talking about each of these. These 10 are not the only things fueling the fire, but they're all key issues that are worthy of our full attention. Starting with tobacco and toxins. The worst thing you can do to your arteries is smoke. Cigarettes and tobacco are loaded with toxins that damage the arteries. It's easy to make the connection between smoking and fire in your arteries. If you still smoke, you've probably tried to quit because you know it damages your arteries, heart, and lungs. Please get help. Tobacco and toxins are also in secondhand smoke, which damages the arteries. Did you know that other toxins can damage arteries? Too much alcohol, recreational drugs, and the cumulative effects of chemicals in highly processed foods and beverages can all potentially contribute to fire in the arteries. Even air pollution has a damaging effect on your arteries. Junk food. We're talking about food products made in factories that have long lists of ingredients. Highly processed foods that do not exist in nature and did not exist 100 years ago. There are thousands of these food products in stores and restaurants, and they're designed and manufactured specifically to make you love them, crave them, and keep buying and eating them. Your body thrives on natural food, not junk food or unhealthy fast food. It's not surprising that those unnatural foods damage the arteries and fuel the fire in them. Not only are those foods bad for your body, every time you eat them, you're missing out on the opportunity to eat healthy foods that heal your arteries. Don't let junk food and unhealthy treats replace healthy food. Next is high blood pressure. A healthy blood pressure is around 120/70 or less. Even 130/80 is okay, but any higher fuels the fire in your arteries. High blood pressure has many causes, but the main ones you can affect are related to food choices, exercise, body weight, and emotional stress. Healthy arteries are relaxed and flexible. Unhealthy arteries are tense and stiff, which forces your heart to work harder to pump blood, resulting in high blood pressure. The high pressure in the arteries causes damage to the artery lining. Next is dyslipidemia. When the fats in your blood are out of balance, we call this dyslipidemia. Having high cholesterol, or too much bad cholesterol, or not enough good cholesterol, or high triglycerides are just some of the different forms of dyslipidemia people talk about. There are many different types of fats or lipids and lipid particles that carry fats in the blood. Certain lipids and lipid particles damage your arteries and fuel the fire inside them. The worse the cholesterol issue, the faster it builds up inside the artery wall, leading to blockages and reduced circulation. Work with your healthcare team to aggressively manage your blood lipids and lipid particles. The right eating, exercise, medication, and supplement strategy are crucially important to minimize and damaging the effects of dyslipidemia or unbalanced fats in your blood. Next is high blood sugar. Everybody has sugar in their blood to provide energy to the organs and tissues. However, if the sugar level gets too high, it causes all sorts of havoc within the arteries. Your arteries are on fire if your blood sugar level is too high. This is especially true for people living with diabetes that is not well controlled. High blood sugar directly damages the proteins in the artery lining and slows the healing of artery damage. In a way, high blood sugar is like a toxin to your arteries. Some people like to imagine the sugar is like microscopic glass shards damaging the arteries. Even if you don't have diabetes, you may have pre-diabetes, which is a milder form of high blood sugar. In either case, eating the wrong meal is like throwing gasoline on a fire. Obesity. Excess body fat, especially in the abdominal cavity, fuels the fire in your arteries. Unhealthy fat accumulates inside the liver and muscles, leading to dyslipidemia, high blood pressure, and prediabetes or diabetes. A fatty liver, also known as non-alcoholic fatty liver disease, leads to all sorts of chemical imbalances inside the body that collectively damage and inflame the artery lining and heart. Have you ever heard the term metabolic syndrome? This is a common condition with a combination of the risk factors discussed earlier, usually linked to obesity. Reducing your daily calorie intake and increasing your physical activity on a permanent basis are the keys to preventing or minimizing the damaging effect of obesity. All body sizes are beautiful, but if you're struggling to lose excess body fat to improve your health, please seek help. The external accountability, structure, and other benefits of a health coach or formal weight loss program can mean the difference between long-term success or not. Underactivity. Your muscles, heart, arteries, and the rest of your body are begging for you to exercise daily and be active. Unfortunately, you can't hear or feel them pleading with you to do so. Increasing your exercise, including gradually increasing your walking, would make a favorable difference in your artery health. Exercise stimulates the blood vessels and blood flow in multiple positive ways. A combination of cardiovascular type exercise, resistance type exercise, and flexibility balance exercise is ideal. Stress. Emotional stress generates stress hormones that stress out your arteries. Arteries have a layer of muscle running along their length, and stress hormones cause that muscle layer to tighten. This temporarily makes the arteries tighter, stiffer, and less flexible, causing blood pressure to temporarily increase. Deadlines, traffic jams, negative people, disappointment, anger, upsetting news, and a whole range of negative stressors have the potential to burn up your arteries by triggering your stress hormones. Minimizing the effect of chronic daily stress is all about avoiding situations that trigger it and practicing positive attitude, which is a skill that benefits from daily intentional practice. You can't always affect what happens to you, but you can affect the way you react to it. Studies show that negative attitude fuels arterial damage, while positive attitude helps minimize it. Gut microbes. Your large intestine is loaded with helpful bacteria and other microbes that eat what you feed them. They love vegetables, fruit, and fiber. The wider the range of plant material you eat, the healthier and happier your gut bacteria are. When you feed them junk food, it fuels a bad cycle. The bacteria turn unhealthy food into unhealthy chemicals that get absorbed into your blood and damage the arteries. An overall unhealthy diet also reduces the types of healthy bacteria and increases the types of unhealthy bacteria in your gut. The science is still emerging, but there's no question that part of the favorable and unfavorable health effects of food is related to the gut microbes. Don't forget, they eat what you feed them, so be kind to those little fellas. Genetics. We know that some people are at a higher risk of cardiovascular disease than others because of the genes they inherited from their parents. However, studies show that most of the risk for artery problems results from the things you can control rather than your genes. The higher your genetic risk of cardiovascular disease, the greater the payoff resulting from aggressive management of the factors you can control. Your genes are not your destiny, and we know that healthy habits favorably affect the way our genes are expressed. Also, knowing your specific genes can often provide valuable information for doctors to help make specific recommendations about food, supplements, and medications to help manage and minimize the risk of cardiovascular disease. In summary, most people with cardiovascular disease, including peripheral artery disease, have a tremendous opportunity to improve several different issues that continue to harm their arteries on a daily basis. The number of unsolved issues has a lot to do with how hot and fierce the fire is burning. On the other hand, if you can make progress on every issue that needs work, then you can put that fire out and let your arteries gradually heal over time. Work with your healthcare team to discuss and protect yourself from each of these potential sources of internal damage. Thank you for the opportunity to present this information today.
Everybody knows that smoking is a big problem when it comes to anything that's got to do with blockage formation, whether in PAD or any other vessel. So why? I'm just start with, it's always good to start with the why, because no one is safe from the ill effects of smoking. And if you go on the CDC website, they have testimonials from patients. This gentleman is 31 years old, Brandon. He lost both legs at the age of 18 from burgers. Now, burgers happens to be different than PAD. One situation where smoking leads to a very intense inflammation of the vessels, but that's one extreme that kind of illustrates that no one is immune from smoking, even the very young folks. And I've seen very young people below the age of 30 lose legs. Another example is another young man. Smoking is not only a problem itself, but it really makes other problems all that much worse. We all know diabetes is a big issue for PAD, but when you add smoking to diabetes, it becomes a very substantial problem for the patients and much, much harder blockages to treat. This unfortunate gentleman ended up passing at the age of 42, had smoked since the age of 15. So that is really why. We want to talk about this because it's not just, well, what if, I lose my leg at the age of 100? It's not the end of the world. Well, no, it's not that. It really happens at a much, much younger age with smoking. So how exactly smoking, does the bad tricks it does on the body? It really does it through multiple things. And I'm going to summarize them here, but there's more to it than this one slide. So smoking lowers your good HDL, your good cholesterol, because the good cholesterol, the HDL, think of it as a sweeper. It runs through the bloodstream, picks up all the bad cholesterol from the vessel walls, takes it back to the liver to discard it. So the higher HDL you have, the better it is. Smoking impedes, lowers your HDL. It raises your triglycerides. That's another bad fat in your blood that raises, the chance of plaque formation. It makes the blood more sticky. It makes the blood more clot prone. It damages the cells that are lining the vessel wall, very, very important cells whose job is to prevent cholesterol and inflammatory cells from seeping into the vessel wall to create the blockage. When those cells get damaged, that's basically how the whole process of blockage gets started and continues to propagate, and increases the buildup of plaque within the vessel wall, eventually causing the vessel to shut down and cause issues. So a quick question to people here in the audience, every cigarette you smoke reduces your life expectancy by how long? And, I'd like people to kind of take a guess between the time between classes, the length of a valedictorian speech, the average Instagram scroll session. You can tell that these questions are tailored more to the young folks who are following all those things. But then 3 songs by rappers. Let's start with Lil. And the answer is it's actually 3 songs. It's every cigarette will reduce your life expectancy by 11 minutes. That's actually pretty astounding if you think about somebody smoking 2 packs a day. That's a lot of minutes reduce of their life expectancy every day. So which of these chemicals is not in tobacco smoke? And obviously I'm leading you down to option E here. These and many, many, many more are all available and present in tobacco smoke and in a lot of vaping as well. And there's actually more than 7,000 chemicals found in tobacco smoke, a little bit less in vaping, but all of them are very bad. And if you look back here, these are bad things here. Formaldehyde is very bad. Cadmium, that's what's in your battery. Acid, benzene, that's a main cause of bladder cancer, in addition to other harms on the vessel side. And this is a non-exhaustive, but a sample of all the things that are in nicotine. This is from the CDC. This is from the Surgeon General report dated 2014. I encourage people to look at it. Arsenic. I don't think any one of us wants arsenic in their mouth or their body. But guess what? That rat poison is also present in the cigarette smoke. So everybody talks about nicotine. I, as a cardiologist, I worry about nicotine, but honestly, of all those chemicals I just shared with you earlier, it's almost like nicotine worries me the least. And it's kind of a good idea for patients to understand, for smokers to understand how each cigarette peaks their nicotine level, at 40 minutes, but it stays in their system for about 120 minutes afterwards. And then what the nicotine replacements do and how they work and how much nicotine they give you. And again, as a cardiologist, I'm going to tell you, but also the cancer doctors would agree, nicotine is the least of our concern, even though it is a concern, okay? But it's all those other chemicals that lead to the damage of that, what we call the intima, the lining of the vessel. That's where the problem starts, okay? So tobacco kills 1,300 people every day in the US alone. These are real numbers. It used to be a much bigger number, by the way, so this is a little better than it used to be, just because less people are smoking now, but still too many are smoking. Think of this as an illustration of what the vessel wall normally looks like, okay? It's really, think of it as a hose with 3 layers. The innermost layer is extremely thin, a single layer of cells called the intima, whose main job when it's healthy is to prevent anything from seeping inside the vessel wall and creating plaque. When that layer gets damaged by smoking or diabetes or the combination thereof, then you start to have cholesterol seeping within, and you end up with this occluded vessel, yellow here being the plaque, and eventually a clot on top of the plaque. This is kind of a cross-section of what the vessel illustration would how the vessel progresses from perfectly healthy to a horrible situation here. And another illustration in different ways, taken more like a long longitudinal cuts. This here is happening already to everybody in their age of 20 and 30 and 40. Plaques form. And when we are living in a healthy milieu, no smoking, no diabetes, those plaques regress. And then another plaque forms here and it regresses, okay? What happens is when we have diabetes, in this case, or smoking or both, the intima, that very, very minute layer the pink layer on top of the plaque becomes, instead of being impermeable to cholesterol and to fats and to inflammatory cells, that intima gets impaired and allows those things to get inside that plaque. And now that plaque is not going to be resolving. It's going to progress, create a blockage. And then eventually that thin intima will rupture and clot will form and the vessel will occlude. And if it's a heart, it causes a heart attack. If it's a leg, it causes acute cold leg or ulcer or whatever it may be. Another way of looking at it, again, that's kind of how this works. It's a gradual progression. And back here, or actually a little before there, it's still reversible if we do the right thing. As we get here, it's still stoppable, okay? Once we get here, we have to fix the vessel, but still do prevention to prevent the other plaques and other vessels that are still in this stage from progressing to here. So again, this is a cross section. This is the lumen of the vessel. This is the intima, single layers. This is healthy. That's what the vessel wall should look like. It's clean. There's no cholesterol in the middle. With smoking, with diabetes, with the combination thereof, with high cholesterol, these layers get harmed. And suddenly this layer that was lining the vessels was impermeable to the bad cholesterol, LDL, to the monocytes, which are inflammatory cells. Now is permeable. It's impaired. So the cholesterol gets into the vessel wall. And in the body, there's one rule. Everything should stay where God wanted it to be. When the cholesterol, which was supposed to be only in the bloodstream, seeps into the blood vessel wall, it creates an inflammation trying to get rid of it. And that inflammation keeps going on, creating, a lot of big words here, but cytokines are inflammatory markers. And, macrophages are another name for inflammatory cells. And little by little, that vessel wall that was normal here now is very huge plaque, complex, with a very thin wall, culprit to suddenly rupturing, creating a clot and occluding the vessel. And that's what invariably happens, okay? Now, the more we promote the health of the intima, that lining of the vessel, the more likely we are to prevent this progression to bad outcomes or retard it substantially. At the end of the day, as we get older, some processes are going to happen. Question here is, are we going to have this at the age of 95, or are we going to have it at the age of 20? And it's a choice in large part is ours. So these processes take years, accelerate in the later stages of development, and are reversible to a large extent, or at least controllable. Did I finish with that? So, and that's basically how you end up with blockages. And the issue with it also, God was very gracious in that, if you develop one blockage, many times there's collaterals around it. But in those patients that we're dealing with PAD and critical limb ischemia, blockage develops, and then another blockage develops distal to where the collateral would form, and then the third one develops. It becomes impossible, for the calf or the foot or the toe to have adequate blood flow, to have no pain, and to have full function. Now, on top of all that, there's also the cognitive part of smoking, which is a very addictive process by design. The cigarette is designed to be very addictive, not just with the nicotine, but also with the ammonia and other components within the cigarette, so that for a short bit, those who take a cigarette will have a short burst of a pleasure, of dopamine release, and then they're constantly seeking that pleasure. Well, guess what? It's not really pleasure, it's destruction downstream in the vessel wall, as we showed you. So it becomes a self-fulfilling prophecy until you break it. Strongly encourage people to look up this report. It's available on the CDC website. It's a very, very long report, a lot of big words in it. It's more tailored for doctors, but a lot of it has good language, even for lay people who are not medical background. And this kind of a summary of that report, it's not that only the blockages, it's also the cancers, it's the chronic diseases, it's the reduced immunity, it's all sorts of things that are really at issue. And these are directly linked to smoking. And these are the diseases that are linked to even secondhand smoke exposure, not a minority of disease processes either. So the major conclusions then are, there's a substantial There's substantial concern here. This has been a long century of epidemic of cigarette smoking. We are far better now than we had been before, but there's still a lot of work to be done. And I am very concerned, and so many other doctors, that I'm very concerned, and so are many doctors, that the new wave of vaping is creating the next generation of smokers. So I'm hoping that we are going to be able to conquer that. I apologize for the noise. And this is kind of what you'll find in that report, how we really have been able with reducing, look at how those curves are going down over 100 years, and parallel that with how the smoking has also gone down. You can see how the curves kind of override, again, further prove how important smoking is in all these epidemics. So in summary, smoking is addictive. Remember that vicious cycle. Cardiovascular harm comes from accelerating the process of plaque buildup inside vessel lumens. That process was already happening, okay, smoking accelerates it. Smoking is especially harmful when coupled with other cardiovascular risk factors like diabetes, like high blood pressure, like family history and bad genetics, like bad cholesterol. On the positive side, the body repetitive processes can reverse some of the harm if given the chance of smoke-free intervals. And that includes reducing your risk of stroke, heart attack, amputation, heart failure, sudden death, cancers, all of them can be at different intervals of quitting smoking, can be reversed back to almost, for some disease states, almost back to a baseline individual without smoking at 10 years.
I love where you talked about vaping, because we get asked that question all the time, where some of our pad warriors will say, hey, I gave up smoking, but I still vape. Is that harmful? That's question number one. And then number two is, well, I don't smoke cigarettes. Is smoking pot still harmful? And my answer to number two, and I'm curious if you agree with me, is the moment that you burn something, it becomes toxic. And the moment you breathe in that toxic air from whatever you burn, it's going to damage your arteries.
Absolutely. I agree with you 100% on both. So let's go with the second question first, because I've had a patient with burgers who was not a smoker, who only smoked pot. And definitely smoking pot can create the absolute worst, if you want to call it, of PAD, because that's a disease state that we really sit there, no matter how good we are, and our hands are tied, and we see very young folks get amputated. So absolutely, marijuana use is linked to burgers disease for sure. Now, going back to vaping, the problem we have, okay, we have to be honest here. On vaping, we have less than 10 years of real history. With smoking, we have over 100 years. We've studied a lot more. We can be a lot more factual and a lot more assertive, okay? So that said, if somebody is already a smoker and is going to use vaping as a bridge, a short-term bridge to get off the cigarette, okay, the information we have now, even though it's not complete, because for smoking we have 100 years, for vaping we only have 10, okay? So the information we have now is that maybe vaping is less harmful than smoking. So if somebody, I really talk to my patients at length about smoking every time. If somebody cannot, quote unquote, cannot quit, I say, okay, well, if you want to go into a bridge of vaping, assuming I don't have the proof for that it's less harm, I'm okay with it. But it's definitely not the discussion I have with somebody who started with vaping, who was not a smoker, because they're starting from zero harm, already taking some harm. Maybe it's less than smoking, but it's definitely not a no harm situation. Was that helpful?
Yes, it definitely is. And we also have a question about, why is smoking following a revascularization even worse than prior to a revascularization? And one thing that I have heard in terms of answering that is that since the blood is sticky, it tends to stick to those areas that have increased inflammation, and where a procedure occurs or where treatment occurs, there is a little bit more inflammation, which could be why it tends to block back up quicker. Is that the case, or do you have another explanation?
What I would say, honestly, Kim, I don't know that I would say smoking is worse post revascularization than before. It's worse, period. Okay, I really don't know that we can say scientifically it's worse after a revascularization. It's just a horrible thing to have. But here's the deal. If you had pad that was bad enough to warrant a revascularization, okay, you are already at the tail end, and you're more likely to have even more harm from continuing to smoke, okay? Well, more accelerated harm. Everyone's going to have just about the same harm. But if you compare two people, somebody who only has a 50% blockage and somebody who has 100% multiple blockages requiring a revascularization, that second person is already further along that bad journey, if you want to call it that, of smoking. And they really they need to get their act together sort of faster than the person with a 50%, if I could put it this way. But smoking is going to be equally harmful every day. Every extra cigarette is equally additional harm to everybody. But when you're still younger and have had less harm, your body has a little bit more time window to repair, okay, on its own, with and without revasc. Whereas when you've advanced to where I or somebody like me needs to revascularize you, okay, you really need to wake up. You need to wake up and smell the roses. Additionally, even though we revascularize, let's say, your right femoral artery, and now your right foot is hunky-dory, happy, and you're healing your wound, well, your left leg probably has a 50 and 60 and 70% blockage that if you don't smoke, if it's going to stay like that, we might not need to fix it. But if you keep smoking, and same thing for your heart and brain vessel, if you keep smoking, those are going to be progressing, and you're going to come back, either with sudden cardiac death, where you don't come back, unfortunately, or with a stroke or heart attack or a contralateral leg amputation, God forbid.
Thank you so much, Dr. Khatib.
There's a lot of different things that can lead to the peripheral artery disease. And one of the things I do is I work with a lot of patients who have chronic kidney disease. And with the chronic kidney disease, I do an analogy with my patients, and what I tell them is that the kidney is what's going to be filtering out all of the end product from your metabolism. So everything that we eat is usually going to be filtered through either the kidney or the liver. And so it's not 100% all going to go through the kidney, but there are some specific nutrients that do go through the kidney that need to be filtered out of the blood on a regular basis. And so what I tell people, the good analogy here is if you have a backyard pool, or any pool for that matter, and if it's filtering out everything from the pool's water is going to stay very clear, very, it's going to look great. You're going to want to be in it on a hot day. But let's say there's some leaves from a tree that are falling into the pool, and they start to clog that pump that's actually filtering out the pool. Or if the pump's just not working properly for whatever reason, eventually you're going to notice visibly a lot of change in that water. It's going to start getting dirtier. It's going to start looking murkier. Nobody's eventually going to want to get in that pool. So essentially, that's a good analogy for what our kidneys do. Our kidneys will be filtering out the end products from some of the metabolism of the foods that we're eating. So what happens is that when these nutrients start to build up and they're not being filtered out on a regular basis, it can lead to other diseases. So, this is where it starts to contribute to other diagnoses, such as the peripheral artery disease. So in addition to not having the kidneys properly filtering, there's a multitude of things that over time, if it's not addressed through the diet, and if it's a very severe stage of chronic kidney disease, like stage 4 and more into stage 5, you'll see a lot of the patients that will be going on to dialysis. If their body's just not filtering properly, then this is where it ultimately leads. But in some cases, it's not 100% preventable to keep the disease from progressing, but the diet has such an important role in preventing the progression. And I have actually worked with a couple of patients where they have reduced their stage of kidney disease and gone from a 4 to a 3. So but I'll be honest, it is one of the toughest therapeutic diets out there because there's so many foods that have to be monitored and kept in check with portion sizes. And it's, looking at labs pretty much every month. Unless they're stable, then sometimes the nephrologist will be okay with not looking at the labs for, like maybe another 3 months or so. But obviously that's usually that, I mean, this is all very individual between the patient and the physician. So, one of the things that, that we can do to help prevent that leading to the issue with peripheral artery disease, because peripheral artery disease is where the blood flow is just not flowing properly. And I want to take it a step even further back and say that a lot of times, again, not every situation or every case will be caused from this with the chronic kidney disease, but a lot of times it starts with diabetes. If they're not controlling the diabetes, then it starts leading into, again, that impediment of the blood flow and the building up of all of these other, and in this case, it's the sugar, and then the sugar starts to lead to the breakdown of and having kidney disease and a multitude of other diagnoses as well. And then the kidney disease compounds into not having that blood flow into the extremities of the body. So, again, diet is really, really important here. But also movement. What I talk to a lot of the patients is I try to encourage them. A lot of them are, when I see them, a lot of them are in some pretty, dire situations with their chronic kidney disease because they may not have had anybody working with them leading up to a latter stage of chronic kidney disease. So even just sitting still, they can, march in a chair. They can use some canned goods to use to do arm lifts and things like that to help, just getting the blood flowing and helping that kidney. And, again, looking at the filtration rate with the kidney, that is the eGFR. So the lower that eGFR goes, the worse it is for this blood flow that's going through the body and it's not filtering out. And the main nutrients that we look at obviously are protein. The end product of the metabolism is going to be amino acids, and those are the ones that are going to be filtered through the kidney. So, watching the protein levels, whether it's coming from an animal source or even a non-animal source, we really want to make sure that they're not getting an overload of that. And something also, right now that's very popular is the keto diet. A lot of people who may be at a predisposition for diabetes as well as for chronic kidney disease may not even know it. And so if they're following a trend, a fad diet, with something like this, with keto, where it's high protein and there's, they're going to see some weight loss because you're cutting out the carbs. And it is actually going to help with controlling blood sugars if they are diabetic. But over time, it could be potentially creating damage in the kidneys, which is then going to also lead to that impediment of the blood flow, which can lead to the peripheral artery disease or actually contribute to it. It might not be necessarily the main contribution to peripheral artery disease, but it will contribute to it. So really wanting to contain that. And again, it's recommended about have 50 to maybe 60% of the protein sources coming from a non-animal source. Because a lot of times too, if patients are getting their main source of protein from animal sources, there are some natural acids that are in the protein, like the meats, that can also lead to other things such as gout. And so we want to try to keep that in control and have more of the protein sources coming from more of a non-animal source, like a plant protein. And one of the ones that they can use is something called quinoa. It's almost like a grain, but it does have a protein in it. So if someone's not diabetic, or even if they are diabetic, just keeping the portion control on that size of the serving to about a half a cup or less at a time. But it's a very good source of protein, a non-animal source of protein. And then pea protein, a lot of people are not familiar with this, but it's something that's been out for probably about the last like 5 to 6 years. I actually go to a lot of the food conferences and have met with the food manufacturer, one of the largest manufacturers for pea protein, and it's just the green pea. It's a vegetable, but they will pulverize those peas into a powder. And that powder can be added into soups, it can be added into casseroles. You can even sprinkle it onto salads. So that's a way to get a protein, but get a protein from a non-animal source. So, but again, this is also, something that a patient would really want to be working with a dietitian, because once you start cutting out the animal sources, you're also cutting out your main source of iron. So a lot of chronic kidney disease patients will have low iron and will need to either have it supplemented because they just are not going to be able to eat enough of the foods that naturally contain it to get the amount to meet their essential needs for that. So that's one of the main things that we look at. Also, potassium is a huge component with the chronic kidney disease. And with that, the potassium is a big component in muscle contraction. So again, the patients are going to want to be watching their potassium as well. But if they have high potassium, over time, that can actually change the heart rate and can be so severe if it's not caught over long term that it can actually lead to death, because it is changing the heart rate. So, watching the salt substitutes, a lot of the salt substitutes will replace that sodium with a potassium product. So that's one thing you want to really try to keep your eye on. And this is really good for anybody, really. You don't want to be getting a ton of potassium. And if you are working outside, or if you're exercising and in a very hot and humid environment, and you are a healthy, normal person in terms of like not having any chronic kidney disease, you may need to replace the electrolytes, and that is one of the electrolytes. But for the chronic kidney disease patients, I would definitely say keep that at, a minimum, and make sure you're keeping your eye on that. And so another one of the nutritional components that are part of the chronic kidney disease is the phosphorus. And phosphorus is really important for strong bones. And it's in literally every cell of the body. It's part of the phospholipid membrane. So it's something also you're going to find in literally every single food. So this is not an easy nutrient to really reduce, because you're going to find it in a lot of, pretty much every food out there. But that being said, there are some foods that are naturally higher in phosphorus than others. So we just try to keep those products that are naturally higher contained to maybe about 3 times a week. Keep the portion sizes to about a half a cup or less when you are eating them. And then again, it's important that these patients, continue to get their lab work, so that, the doctor and any dietitian that they're working with can help them make the appropriate modifications so that we're keeping this all in check. And then sodium is also a big component as well with the diet. So sodium can cause fluid retention, which again, if that's another one of those nutritional components that is also regulated with the kidney filtration. So it can lead to water retention, and over time that can also lead to fluid buildup around the heart, which can lead to congestive heart failure. So we would want to kind of keep the sodium in check as well. So to about 2,000 milligrams on the sodium and the potassium, both or less a day, is typically what I recommend for the patients who are around CKD stage 3 or less. Anything above that, we really kind of have to be a little more restrictive. So that's kind of in a nutshell, the components of the chronic kidney disease diet. Obviously, there's a lot more to it than what I would have time to go through on this segment, but this is how it all leads to, other diagnoses. So, if a patient is controlling the chronic kidney disease and they're getting some movement every day, And I usually try to tell people, especially the ones that have, they might be obese or they've never really moved, and now they have a lot, people feel bad when their values are out of the normal range. So a lot of times they're not feeling like getting up and just going for a walk around the block, or even trying to move around, even in their home, if it's, too hot outside. So even just any movement they can do is going to help that blood flow, so it's not pooling at the bottom of their feet, and then causing other damage down the road. It really goes hand in hand, and we do, and I personally as well, try to look at the whole patient. It's we can't just isolate one area of the therapy. It really all works together. And if something's not being incorporated in to their routine on a regular basis, it can over time lead to, other diagnoses such as the peripheral artery disease. But really, this is something that, we really try to work with these patients and on a very personal, individualized basis. But these are the overall components for the diet for the chronic kidney disease.